Kenya is running low on blood. With the effects of COVID-19 still being felt, our blood banks are half empty, and the government is urging Kenyans to help replenish the banks. Meanwhile, the government is yet to come clean and put its systems in order in regards to allegations of blood smuggling to neighbouring countries. Eunice Omolo reports.
Aisha Dafala has been donating blood for 40 years now. She started at the age of 17 years. Today was her 67th donation, and she's the highest female blood donor in the country.
As I've told you, today I've donated my 67th time. I want to do 70. So when I reach 60, I'll stop.
She's one of the many Kenyans who have kept the banks flowing with blood, but now the supply is running short, and COVID-19 has been part of the problem.
It takes you a whole day, and it means standing alone. So there are a number of challenges we have had there, and the volume has actually dropped because I remember like before the COVID, we would collect up to 1,800, and we went down to 400 units.
Nairobi's blood banks usually have higher supplies and targets compared to other counties. However, it has never attained its target of 88,000 units annually, when the county collected 35,141 units, and the lowest was last year when the Nairobi region collected only 5,720 units the whole year. In the last 3 years, the number of units collected have been on the decline.
The requirement was still high, but the volume from our collection of 2,000 in Nairobi region, that is, to 400. Now you see, 1,400 units are not there. So
2,000
per month. Yeah, that is Nairobi, but it's still below. Because in Nairobi, if you want to feed Nairobi well, you need about 400 units a day. So in a month, it's 400 times 30. So you need around 12,000 units in Nairobi. Let me say 9 to 12,000 units of blood in Nairobi daily. I mean, in a month. That is when you will be able to serve the population properly, and there will be no deaths about blood.
Despite Kenyans diligently giving blood, the government has acknowledged that gross management at the institution has adversely affected availability of blood in the country. In addition, not enough action has been taken against those who smuggle blood out of the country.
It has been comical, because when we hear that our blood is sometimes servicing places like Mogadishu, then it would be funny if it wasn't so tragic, because it meant that the management of this institution, left a bit to be desired, to speak politely. And I want to say that since the appointment of Dr. Duko and her team here, I just want to say that there's a turnaround in terms of the work that they are doing and the approach that they are using in blood, in national blood transfusion.
Health CS Mutahi Kagwe was speaking today during the launch of blood donation drive that will run through the week of 14th February.
Timely access to blood transfusion services is important in saving the lives of patients who are in critical care and those who are in dire need of the services. However, in Kenya, most patients miss out on this critical service because of a number of bottlenecks, and the government is yet to clear the clog to ensure a free flow of the blood transfusion services in the country. Eunice Omolo, NTV, Nairobi.